We can see that when societies around the world, places around the world started to talk about how to respond to COVID, and for instance, who might be prioritised for health and medical care, often there were assumptions brought to bear about whose lives were worth more than others.
I think we see this paper as an example of how sociology can respond quite rapidly in an unfolding and a fast-moving situation such as a public health emergency.
During the pandemic, there are a lot of concerns about the rise of racism against Asians. The virus triggers all these social complications. A sociological perspective can get us into thinking about how various domains in social life are deeply connected to one another.
But when we look with a social science lens, that helps us understand how people act and that impact on spread.
That social science have a fundamental role to explain and to understand the configuration of specific risks, such as this pandemic.
The central argument in my paper is that although conventionally public health is viewed as an evidence-based profession that is above politics, national responses to COVID in India reveal that health and illnesses are concerns that are embedded in the larger politics of the state.
Medical discourse inseparable from political discourse.
Gender seemed to inform the type of responses that political leaders were adopting. There was a tension between, shutting things down and trying to limit the spread and being very concerned about the impacts on health versus this more, take care of business and push forward despite the risks.
Our analysis seeks to follow the numbers, that is, to follow the projections of some of the more predominant models, and trace how these move from the model into social life and public concern, as well as public policy change.
And we saw that there were some really similar reactions to people with disabilities, perhaps being treated as dispensable in some ways, but then there were also some social interventions that took place. For example, the shopping hour that was introduced in both of our areas, but they were reacted to in quite different ways in Singapore as related to Australia. And I think through examples like that, we can see that disability is in many ways constructed through society and in different ways within society.
For a society like India, that is already structured and segregated on lines of caste, class, race, religion, gender, social distancing becomes a measure for the state to co-opt scientific interventions of risk mitigation and relay them to people as a metaphor for exclusion, thereby exacerbating deeper structural inequalities around which access to health and well-being of the population is organized.
It's an example, in a way, of how sociology can have a praxeographic entanglement with the objects which it's studying. At the same time, of course, the reason for reflecting on science as it is being made in the now is also to reflect on how such science and policy might be made up differently in the future.